Hello everyone, in this video I'm going to talk about the mechanism of normal labor. So yeah, let's get started with the topic. Today in this slides we will discuss about when does the normal labor start, how long is labor, stages, mechanism, management and danger during labor, and what is normal labor. So yeah, let's get started. Firstly, labor usually starts within 2 weeks of the estimated date of delivery, which is given by the doctor. Estimated date of delivery. Exactly what causes labor to start is unknown. Yes, basically we can say that it is oxytocin that is responsible for the labor to start. But EDD is given by the doctor that yes, by this date you will have your delivery. So the labor starts within 2 weeks before or after the estimated date of delivery, that is EDD, abbreviated as EDD. On average, labor lasts 12 to 18 hours in a woman's first pregnancy. If it is women's first pregnancy, then it lasts for about 6 to 8 hours. Okay. In subsequent pregnancies, it decreases. Now, starts of labor. Every woman's labor is different. Persistent lower back pain or abdominal pain with premenstrual feeling and cramps. Okay? So this is the symptoms that yes, there is a start of labor. Painful contractions because of the oxytocin that occurs at regular and increasingly shorter intervals and become longer and stronger in intensity. Broken waters. What is broken waters? This is the symptom. This is the sign that there is a start of labor. Membranes made up to with a gush or a trickle of amniotic fluid. Phases of parturition. Phase 0. There are three phases basically. There are four phases: phase 0, 1, 2, and 3, which indicates the phases of parturition. First is the uterine quiescence. First is the uterine quiescence, which is the phase 0. Phase 1 is the second, that is preparation for labor. Phase 2 is the process of labor, which again has three stages. The first stage of labor, cervical effacement and dilation. Second stage is expulsion of fetus, and third stage of labor is the separation and expulsion of the placenta, where the placenta is expelled out of the uterine cavity. Phase 3 is the parturient recovery. So as you can see, there is a flow chart. Phase 0, where there is a prelude to parturition. Okay, here the contractility is of no, there is no marked contractions. In phase 1, activation, there is activation, preparation for labor, where the uterine prepare for the labor. Uterus cavity prepare itself for the labor. Phase 2 is the stimulation, where which goes under the process of labor. Phase 3 is involution, which is the uterine involution and breastfeeding. Okay. Now, aims in the management of labor. To achieve delivery of a normal healthy child, it is the malpractice cases. Okay? To recognize and treat potential abnormal conditions before significant hazard develops for the mother and or the fetus. Principles of the management of labor. There are four principles for the management of labor. First is the diagnosis of labor. Diagnosis of labor, that yes, there is a labor pain. It is the abdominal cramps, the pelvic cramp, the premenstrual bleeding. All our signs should be of the labor. We should diagnose that is the labor. Monitoring of the progress of the labor, that where the child, where the baby has arrived in the pelvic cavity, or what stage it is. Okay, so this is the monitoring of the progress of labor. Ensuring maternal well-being. It should be assured that for a normal delivery, the patient, the mother, should be well-being, healthy, and also for ensuring fetal well-being, that is there is no malnutrition, no kind of cord prolapse or anything like that. Criteria for normal delivery: spontaneous expulsion, mature fetus presented by vertex, through the birth canal within a reasonable time, more than 3 less than 18 hours, without complications to the mother and without complication to the fetus. There should be no complication to the mother or fetus in the normal labor is the criteria for normal labor. Influencing factors, the 3P are the influencing factors, that is power, passenger and passage. So yeah, what is power? That is uterus. What should be the uterus should apply power, that is you will know about what is power, passenger and passage. So first stage, this is the important topic that we are going to cover, stages of delivery. First stage starts with the onset of true labor contraction, ends with the cervix is fully dilated, longest stage of the labor. See, first stage is the longest stage where the cervix is about to fully dilate, and it starts with the onset of true labor contraction. This is the longest stage of the labor. Second stage is begin with the complete dilation of the cervix and ends with the birth of the baby. Okay, that is cervix is fully dilated in the first stage, and now the dilation of the cervix begins and birth of the baby. It ends with the birth of the baby, and duration is total 30 to 90 minutes is the duration. Okay. What is the third stage? Is the separation and expulsion of placenta and membranes. Duration is 5 to 30 minutes and is the shortest stage. Fourth stage is after the expulsion of placenta. Duration is 2 hours and increased risk of bleeding, where the mother bleeds a lot of lot of bleeding is there. Now, first stage of labor, first stage of delivery, what we were on that, regular contraction, stronger and stronger contraction, increasing in frequency, and longer contraction is there for the cervical dilation and effacement. See, for the first stage, that is the longest stage, there should be a proper cervical dilation and effacement for the delivery of the baby. So there is a regular contraction, in fact increasing in frequency. So let's discuss phases of cervical dilation. This is the latent phase and the active phase. The latent phase is the first 3 cm of dilation. It is a slow process. Once it reaches the 3 cm of dilation, then there is the active phase and increase in the dilation from 3 cm to 10 cm. That is full dilation. Next is the latent phase. Onset is regular contraction and to the 3 cm, and the same that we discussed. For the prolonged latent phases, what happens in the nullipara women with having nullipara uterus, then the latent phase is less than 20 hours. But I'm sorry, is greater than 20 hours, which is the and greater than 14 hours in multipara. So it is the latent phase in the nullipara and the multipara distinctly. Active phases is the cervical dilation of the 3 cm जो prolonged हो चुका था, अब उसको और 10 cm तक ले जाना है. And then there is a protraction, slow rate of cervical dilation, arrest, complete cessation of the dilation or descent. ठीक है, there should be an arrest of the first stage, that is cervical dilation. Now second stage of delivery begins with the full dilation of the cervix and with the delivery of the baby. So let's get started. So it has two phases again, propulsive and expulsive. Propulsive, from full dilation until presenting part has descended to the pelvic floor. See, it is previously diagnosed that what is the lie, presentation, attitude and all of the baby. So now we are so now we know what is the lie and presentation. So when the presenting part of the baby, which is different in different cases, so presenting part is now descended into the pelvic floor, and it ends with the delivery of baby. In between that there is a lot of phases, but we'll discuss it. Second stage of labor, that is expulsion. Third stage is where the placenta has to be expelled out of the uterine cavity. So there is separation and then expulsion. Separation and expulsion, it takes all total of 5 to 20 minutes, and blood loss is 150 to 250 ml average. फिजियोलॉजिकल इफेक्ट्स मदर फर्स्ट स्टेज पे मिनिमल इफेक्ट सेकंड स्टेज पे पल्स इंक्रीजेस सिस्टोलिक ब्लड प्रेशर इंक्रीजेस एंड माइनर इंजरीज टू द बर्थ कैनाल एंड थर्ड स्टेज पे ब्लड लॉस फ्रॉम द साइट ऑफ प्लेसेंटा fetus पे molding and molding both are the same physiological effects. Mechanism of labor. So lie presentation, attitude or posture, positions. So about the mechanism of labor we will discuss in the next part, that is our next part of the video. In part 2 we will discuss about the what is lie presentation, attitude and position, which is the topic of our syllabus also. So these are we are going to discuss, so must watch next part 2. Thank you for watching my channel. Please do subscribe because next part 2 is about to come soon and we'll update. Thank you.